Hi, I'm at the 4D headquarters with Dr. G, the creator of
Hey.
4D Pro. A lot of people actually complain that they don't want to exercise because they hurt or something hurts.
Mm-hmm.
How would you respond to someone who said that to you?
Well, it's always about the nature of the pain, of course. You know, if there is a pain during movement, that is, you have to have a close look at it. If it makes movement impossible, or if it's just hurting because it's tight. With a 4D Pro, you usually do not have any hard impact. It's very organic movement. It's elastic forces here, and there is not much really that could go wrong. And if you do something wrong, then the result would be no movement at all. So if you do it right, you move and you bounce. And the pain usually is not because of the movement, but because of the many years of not moving. And the pain subsides and goes away after a few seconds, even after a few minutes. Using the 4D Pro, your body engages more and more chains that make that movement possible, that generate that movement and that bounce. And our experience is that pain actually goes away within that one session, the training session that you go for it. Of course, 2 days later you will be sore, but the rest is really most of the times it's just based on a myth and on a misunderstanding. And unfortunately, me being a medical doctor, I know it, and I've done this myself before. We tend to tell people not to do things that are painful, which in the first impression seems sensible and also correct. However, there are too many occasions where it actually creates the opposite. Arthritis, for example, osteoporosis, all this stuff is actually a result of lack of movement. Back pain, joint pain is more or less a result of a lack of movement instead of movement. And I mean, there is even a huge study that came out in 2014, I think, from an orthopedic surgeon here in Germany, in Ulm, and they went with a run that goes from southern Italy to northern Norway. It's 4,500 kilometers within 64 days, and he just accompanied these runners with a huge truck with diagnostic tools in it. So, and he took an MRI at every station, and he found out that the cartilage, the thickness of cartilage actually increases with this run. So up to 2,500 kilometers, there is not much of a change, but anything beyond it, they even had a thicker joint cartilage than before.
Wow.
And that turned the whole paradigm upside down that we had before.
Thank you for explaining that, and stay tuned for more.